as we think about some of the lessons from this morning. So I tried to quickly summarize because we just had this discussion, and I will touch upon many of the themes that the prior three moderators have touched upon, but I'll try to be brief so we can get to the meaty part of the discussion. So today we had three case studies really looking at past successes and demonstrating, various aspects of what we've been talking about. So Bob Coughlin spoke this morning really passionately about a key success story from cystic fibrosis, even though we still have a ways to go, but so much innovation has happened because very, very, committed and passionate patient advocacies and groups really have pushed on closing that gap where early on there's a lot of risk, it's a small patient population, and it took parents like Bob, whose own son suffered from cystic fibrosis, to really identify what was truly actionable, talking to various research groups, pharma, to the government, to individuals, venture philanthropy, to really push forward. So it's really a great example of a success story. And another important part about patient engagement that we already talked about a little earlier is really, pushing for endpoints that are truly reflective of quality of life. What's important to the patient? If they have to sit there with a nebulizer 3 times a day for hours at a time, it's great that you can get life extension. That's really important. But, can we do better in terms of enabling that life extension, but with also improvement in quality of life? It highlighted some of the challenges of advocacy. People don't always have the time and the resources to be able to spend that extra time involving their children in clinical trials or going and advocating and lobbying. It's really important that we think about this, particularly with underserved populations. And it's also important to continue to invest in the basic science. And he brought up the mRNA example of, key technologies being enabled with not a clear initial application, or maybe some early applications that didn't move forward. But then along comes a situation like the global pandemic, and we see having these technologies available are so important. And so Bob really spoke from the heart. He shared his personal story about his son, and we all need to rally around, parents and families who have children and family members with diseases, and we need to keep the patient, in mind. And, humorously, he talked about, being loud and obnoxious is a big part of it. But all kidding aside, it does take an active patient and caregiver and stakeholder voice to really see change. From then on, we had Raulat, and I'm shamelessly borrowing from the next couple of presentations to make a couple of points. So she spoke about a couple of key things. One is that the integration of patient-facing digital health tools in trials for chronic disease management. And it's really important because she highlighted that when thinking about the patient, it's not just about a measurement and, FEV or 6-minute walk or tremor or anything like that. It's really a holistic look at what the patient's needs, everything from inputting medical information to behavioral health, managing the emotional components, and even just their daily lives. And it also needs to engage their caregivers and really allows the patient to achieve self-management. And clearly, as Howie pointed out, this is all going to be generating a lot of data. So how do we manage this data, and how do we make sure that it's accessible to everybody? And furthermore, when you think about all the innovation in technology and clinical research, and again, Howie talked about this, we're going to generate a ton of data, but the good news is that there are technologies, there are companies looking at every aspect of clinical trials that can really enable risk mitigation, acceleration, new approaches, cost savings, perhaps integrating some of these novel biomarkers, especially composite endpoints. And so there's a lot of optimism about the future. There are challenges, but I think Raulat did a great job of highlighting how all these technologies are coming to bear. And then importantly, we've talked a lot today about collaboration. And so she highlighted the Innovative Medicines Initiative in Europe and how that it took, a number of years, a lot of investment. But she highlighted a success story with respect to COPD, where the consortium enabled two patient-reported outcome tools that are now in use that are really important given that these diseases are complex and there's multiple comorbidities and multiple things going on. So it's really important to push the field forward. But it took a tremendous amount of collaboration. So it's a great model for the future. And finally, Robert Heine, if I can get this to move forward, really use the example of metabolic syndrome and all of the associated disorders, which really cut across specialties: nephrology, cardiology, endocrinology, neurology, and the fact that this area is particularly worrisome, as demographically it's growing not only in the U.S. but globally as well, and it just leads to so many other comorbidities, so many sequelae, and really it's an enormous problem to tackle. But importantly, he highlighted a number of considerations and approaches, and I want to just highlight in his last slide where he talked about really focusing on total disease burden. So it's not just one particular endpoint like weight loss or blood sugar control or any of the other things. There's so much to the disease burden that cuts across organs, cuts across various biological pathways. And it's really, really important to take that holistic approach and to look cross-functionally at these various specialties. And then really looking at real-world evidence. What is truly happening in these patients' lives, and what kind of interventions can we innovate on, even beyond a single drug in many cases, although there is a tremendous need for new modalities to treat them. So in summary, and again, I'll quickly go through these because many of these themes my co-moderators have highlighted. We talked about how they're complex and multifactorial. I think an important element is the health economics and the payer incentives being aligned, as we've talked about earlier, where a lot of times there are secondary and tertiary costs of these diseases that aren't captured in the immediate health economics argument, and they need to be captured better because these impacts are real. So there's a real opportunity to think about the overall patient journey from a very early stage, and then think about new treatment and paradigms enabled by these, whether it be existing drugs with new routes of delivery, optimization of different combinations, integration of new and validated endpoints, all the digital tools we talked about. Importantly, voice of the patient and equitable access are two themes that resonated actually throughout the entire workshop, not just in our session. And the fact, again, we cannot state it enough, underserved populations are disproportionately effective. So we have to do better at every level. And it really requires that new level of what Raulat called radical collaboration. And it's a number of stakeholders that all have a vested interest in this, and we need to work. This is really a call to action for all of us to work together on this. So with that, I'll hand it back to our co-chairs, and thank you very much.